Good afternoon, everyone. This is Thaisa Kelly from Monarch Housing Associates, and we also have Jay Everett from Monarch, and we will be hosting the 2016 point-in-time count training. In this training, we'll be going over the 2016 survey, some of the tips, the changes, and how to actually administer the survey for the count this year. Before we get started, I just want to let you guys know that we will be taking questions along the way, but we do ask that if you do have any questions that you type them in the chat box on the side of your screen. According to the question, we will either answer them as we're going through the presentation, or we will take some time at the end of the presentation to read those questions and answer them for you. So please do feel free to send any questions that you might have through the chat box that is on your screen. And also, as a note, I just want to say that for many communities across the state, we are doing in-person trainings. So if you would also like to attend an in-person training to catch up on anything, or if you know of people who are not able to participate in this webinar but still need the training, please be sure to connect with your point-in-time coordinator to find out when the trainings are scheduled in your community, so that anybody administering the survey has the ability to complete this training before the point in time itself. So within this presentation, we're going to be going over what the point-in-time count is, who's counted, some of the different things that we have, and actually how to enter the information online. There are several different guides and different things that we've put together to assist you guys in the process of actually completing the count. All of these materials are available on our website, monarchhousing.org, and you will see that website printed on the bottom of the slides throughout this presentation. And so we want to make sure that you have all the resources that you need in order to complete this survey successfully. So please be sure and be aware that we do have training guides, different online data tools, and reference guides to help you in the process as you're completing the survey. So with that, I'm just going to kind of jump into the presentation. All right. Okay. So, sorry. So we've got the data collect. So in terms of the actual point-in-time count, we have a data collection guide that we put together, which is actually a written guide of all the information that we're providing to you here in this training, but it's also an opportunity for you to reference it and to kind of refer back to anything that you may have missed or you might have further questions on. We do have everything written down that we have in this training in the data collection guide on our website. We also have a quick reference guide on our website. This we strongly encourage you to have with you when you are administering the survey. It goes over some definitions and some quick pointers about some of the questions, how to ask the questions, some of the things to keep in mind while you're asking those questions and answering the questions. It also has some of the codes necessary for the survey itself to help you as you're going through the survey. Please also do keep in mind the point in time is something that is required by HUD for communities to complete. And as a result, HUD has put out a couple of different guides to help communities understand how to best implement their point in time counts. So on the HUD Exchange website, you see the web links there. They do have a methodology guide which goes over how to complete the count, and they also have a data collection guide which goes over specifically who should be included in the count and how you actually collect that information, what information to collect. So we strongly encourage you to take a look at these guides. All of the information that we have put together for the statewide survey has taken into account the HUD guidance and reflects the requirements based on HUD in terms of the information that is collected in the survey. So what is the point-in-time count? First, I want to say the point-in-time count is scheduled for January 27th, 2016. And it is a one-day count of all the people who are experiencing homelessness within the community. We are trying to get a glimpse of what homelessness looks like in the state, across the state. So the point-in-time count, we are trying to get an unduplicated count of those who are either living in emergency shelters, transitional housing programs in your communities, or who are unsheltered, those who are living on the street. As per HUD requirements, the count is conducted the last 10 days of January, and in the state of New Jersey, we do the count all on the same day, and we do it on the last Wednesday of the month of January, hence the date of January 27th. And locally, you guys are coordinating and planning how that count occurs within your community, with us providing some statewide guidance around what the survey looks like and how to administer that. We use the point-in-time count to gather information for local planning purposes as well as for reporting to HUD. When we get to the slide of showing you the actual survey, if you have not seen it as yet, the first page of the survey really goes over all the information we need to report to HUD, and the second page of the survey collects additional information that is useful for local planning purposes, and this has been helpful for communities to figure out what types of programs they have, what types of programs they might need, where to target their resources, and what the trends are in the community of those who are experiencing homelessness. For the point-in-time count, we are collecting information about 3 different categories of people. We first have the unsheltered homeless. These are the persons who are sleeping on the streets, park benches, in abandoned buildings, those who might be sleeping in their cars, buses, train stations, places that they're really not meant to stay. And this is the unsheltered count, the street count. We also are collecting information about people who are homeless but in sheltered situations. So those are people who are living in emergency shelters, transitional housing, or hotel or motel placements paid for by an agency. And also, as a note, shelters also include domestic violence shelters and youth shelters. The third category of people that are included on the survey are those who are at risk of homelessness. So this includes some of the categories of people that you would consider, such as those who are doubled up or couch surfing, people who are in jail or being discharged from a hospital or some sort of institution where they have no place to go once they leave, if they're about to be evicted, or if they're staying in a hotel that they're paying for on their own. I just want to make one note. The survey does allow for you to collect information about all 3 of these categories, and we encourage you as a community to plan and to think about who you want to collect information for. In terms of reporting for HUD, we are only going to be reporting the homeless population based on the sheltered and unsheltered populations that are identified, but we will collect the information of the at-risk population and provide that to the communities for analysis so that you can better understand the needs of the at-risk population. In terms of the 3 categories, there are 2 different ways that we are collecting information for those who fall into those 3 categories of unsheltered, sheltered, and at risk. For the unsheltered population, remember, these are the ones that are staying on the streets, abandoned cars, etc. You will be administering paper surveys to them, so you will be physically interviewing them the day of the count and filling out surveys based on the answers that they give you. For those who are in sheltered populations, the information for that population will be pulled directly from HIMIS if the program is entering information in the local HMIS system. So if you are an emergency shelter or transitional housing program and you are entering your information in HMIS, that information will be pulled directly from the system and you will not need to complete a paper survey. Paper surveys should only be completed by those programs that are not in HIMIS. So, for example, domestic violence programs, which are prohibited by federal law from entering information into HIMIS, will need to complete paper surveys for all the people that are in their program on the night of the count. This is also true of any other sheltered program that is not in the HIMIS system. So all sheltered programs will be submitting paper surveys, or their information will be pulled from HIMIS. We are also asking all sheltered programs to submit a summary form, sheltered summary survey, which basically tells us how many people were in your program on the night of the count. This is used to cross-check and ensure that we have the correct number of surveys and the correct number of records in HIMIS for your program, so that we can ensure that we have an accurate accounting of the number of people that were homeless. For those who are at risk of homelessness, for that population, paper surveys will be completed to collect information about those who are at risk of homelessness. In the previous slide, I mentioned the sheltered summary form. And here is an example of what it looks like. We have streamlined it. It is a little bit simpler. We are simply asking that you fill in the information about the county in which your program is located, your agency and program name. If your program is in HIMIS, we would like to know the HIMIS name, and we simply need to know how many people were in your program on the night of January 26th. This number that you put in there should include adults and children, and we just want to know exactly how many people did you serve that night. This form will be collected by January 29th. And as I mentioned before, we will use this to cross-check and ensure that we have an accurate number of surveys or HIMIS records for your program. If you have one program, you will fill out one box on this form. If you are an agency with multiple programs, you can use one form and fill out one box for each of your programs. Please be sure to write your program name clearly, and if you are in HIMIS, please ensure that your HIMIS program name is written on that form as well. And this form should be completed by all agencies that are providing shelter, emergency shelter placements, transitional housing to homeless households. This is an example of the paper survey. It is a two-page survey. Hopefully when you have it printed for you locally, it is a one-page survey double-sided. And there are 12 questions on the survey. The survey is pretty similar to how it was last year. There are two new questions on the survey, which we will go over in more detail. But if you have not received your paper surveys as yet or have not seen them, I would strongly encourage you to contact your point-in-time coordinator for your community, your COC, lead agency, to get more information about the paper survey and to get a copy of it. So the point-in-time count, as I mentioned before, will be taking place on January 27th. The survey will be asking, where did you sleep on the night of January 26th? So for any communities that are doing an overnight count of the homeless, you can begin those counts at sunset on January 26th. And if you're doing the overnight count, then your overnight count should be from sunset January 26th up until sunrise of the next day. For those communities that are doing a daytime count, then your count will take place on January 27th, and you will be asking the question, where did you sleep on the night of January 26th, on the Tuesday night before? For any communities that are interested in taking advantage of this, and you will need to check with your point-in-time coordinator to verify this, there is a 7-day window for administering the surveys as a service-based count for the unsheltered homeless. So for example, if your community has soup kitchens or day shelters, drop-in centers where people frequent, you have the ability to survey individuals that are going to those locations for a 7-day period after the night of the count. So from January 27th until February 3rd, you have the ability to administer the survey. When you're administering the survey during those 7 days, you will still be asking where they slept on the night of January 26th. So even if you're conducting the survey on February 3rd at a drop-in center, you will be asking them, where did you sleep on the night of January 26th? Please, again, do check with your local PIT coordinator to verify whether your community is taking advantage of that 7-day window. But this is an opportunity for you to help better capture the unsheltered population within your community. So some general survey guidelines. Only one survey should be filled out per household. On the survey, there is the ability to enter information for other household members. So a household is defined as any grouping of people that are staying together. So if they are defining themselves as a household, you can maintain them as a household. So this can include groups of adults that are traveling together. This can include adults and children traveling together. As long as they identify themselves as a household, one person within that household has to be identified as the head of household. Typically, the person who is answering the survey is the head of household for the purposes of this process, and you can label them as the head of household for this survey process. For the survey process, you should be conducting the surveys and reading the questions to the respondents and not giving them the paper to fill out. We do strongly encourage you to look through the survey prior to it, become familiar with it, and then when you are administering the survey, you can speak through it talk through the questions with the people that you are administering the survey to ensure that they understand it, and then collect their responses as appropriately. For questions on the survey that say check all that apply, please do not read all of the answer options. Please just read the question and then let them tell you which ones, for questions that say check one, please do not read all of the answer options. Read the question and let them identify which is the appropriate question. So for example, the first question on the survey is, where did you sleep the night of January 26th? Please do not read all of the options to them. Let them tell you where they slept, and then you check one. If the question says check all that apply, you can read all of the options that are available to them so that they are aware of what is possible in terms of an answer. But if it says check one, please do not read the options. For the purposes of data analysis and reviewing of the surveys, we will be cleaning up the data and kind of narrowing down the survey so that we can put together the information to report to HUD. And in order to do this, we will need to have some basic information answered. If a survey has question 6B, the relationship of head of household, age, gender, race, or ethnicity, if we do not have information for those questions, we will not be able to accurately report information to HUD about the household. So we are asking if you receive a survey or if a person refuses to answer any of those questions for the first half of 6B, we're asking that you please take a guess and fill out that information for the respondent so that we can use that survey to accurately report to HUD information about those who are experiencing homelessness. If the person you're administering the survey to is a member of a family and they're not sure of the information for the rest of their household members, they can take a guess. So for example, if they're not exactly sure of the age of their mother, they can take a guess for their mother's age. So we're asking that for age, gender, race, and ethnicity, that information is filled out on the survey, and if you do not know, then you can take a guess. If there is no response to question 1 on the survey, where did you sleep the night of January 26th, that survey will be thrown out. We will not use that survey in the analysis. So please be sure that you are asking all of the questions on the survey and filling them all out, because some missing information will automatically cause us to throw out that survey and not use it for the purposes of reporting to HUD. As a note, if you are part of a program that serves one particular population, please do be sure to indicate that the household you're interviewing or household that you're completing the survey for is a member of that population. So for example, if you are a veterans program and you only serve veterans and you're administering a survey to somebody in one of your programs, please be sure to check the box that they are a veteran under the characteristics, because by default they are so by virtue of them being in your program. We do not know the specifics of each program across the state, so we cannot take a guess. And if you do not indicate that they are part of that population, we will have an inaccurate account of how many people are experiencing different things, such as veterans, victims of domestic violence, those with mental health issues or HIV/AIDS. So please be sure to check the characteristics, the disabling conditions for persons that you're serving, especially if your program is specifically designed to serve that particular population. And again, that is also true for domestic violence programs. Make sure that you are labeling all of the clients in your program as victims of domestic violence. If you are a program that is entering information in HIMIS, the only time that we are asking that you complete paper surveys is if you have a person who comes to your door on the day of January 27th. They were not in your program on the night of the 26th, and they are homeless. So you would complete a paper survey for that household because they were not in your program, but they're at your door on the day of January 27th. So if you are doing that, please be sure that the only way that paper survey will be counted is if the location identified where they slept the night before is not your program. And in general, for the deduplication purposes, we do understand that we will likely get duplicate surveys for people. We will be erring on the side of the HIMIS records for any duplicate surveys or surveys completed by agencies that actually serve the person. So for example, if you had a shelter that completed a survey and the person went to a Project Homeless Connect event where the survey was completed at the Project Homeless Connect event, we will be using the survey from the shelter. If we have a survey that was completed at a Project Homeless Connect event and a person was in a shelter with a HIMIS record, we will be using the HIMIS record over any paper surveys. So just a note for you, if there are duplicates, that's how we are going to deal with them. HIMIS participating programs. For any program that provides hotel placements, if you have not set up your program as a separate program where you're only entering the hotel placements in HIMIS, we will not be pulling your record. So this is specifically for service-only programs in HIMIS that typically have hotel placements, rental assistance, utility assistance, kind of all in one program. If you're doing multiple activities under SHUSH or some sort of prevention money that you have or other funding that you might have, if you are not separating out the hotel placements from the others through a separate program, then we will not be pulling information from yours from HIMIS, and you will need to complete paper surveys for anybody that you place in hotels on the night of the count. General tips for the interviews, just make sure that when you first meet with a person that you ask if they have completed the survey already. This is one of the easiest ways to avoid duplication. If they've already completed the survey, there's no need to continue the process and have them sit through another survey again. Please be sure that you let people know that this is anonymous, that we are not collecting any specific personal information for people. We are not able to track the information from these surveys to any particular person, and we have no interest in doing so. This is purely for aggregate data that we can report to HUD. Please try to, conduct the surveys in a quiet, private place, in a quiet manner, and just be aware of making sure that people are understanding the questions that you're asking so that they can respond accurately. Use the survey guides that we have there for you, and please, obviously be friendly, respectful, and polite as you're talking to people, and thank them for their time in participating in this process. On the survey, you will notice that there are a couple of codes at the very top of the survey. These are codes that we use so that we can trace back surveys if there are any questions or when we're doing the deduplication process. These should all be filled out for you by your point-in-time coordinators in your community. If you get a blank survey and this information is not filled out, please be sure you have received your agency code from your point-in-time coordinator and you understand what code should be at the top of the survey and connect with them so that this information can be filled out accurately, because we do use this for deduplication. With that, I'm going to turn this over to Jay, who will go over the specific survey questions and how to get through the survey. When you're muted, you're still. Do you want to use my phone? I apologize for the delay, but Jay is going to jump on now and go over the survey questions.
Sorry, folks. Thank you. This is question 1 of the paper survey. If you're looking at a copy of it, you can see that it's in the top left-hand corner of the survey. It's asking, as Thaisa alluded to, where did you spend on the night of Tuesday, January 26th? And as she said as well in the guidance, check 1 only is in parentheses after the question. So that basically means that we're going to just ask the bold question and then stop and let the person who's the respondent give us an answer, interpreting their response. You'll note for a number of the questions on the survey that if their response doesn't fit one of the maybe cookie cutter answers that are options here, that you can see there's an other box at the very bottom. So you'll be able to select other and choose to write in an option if that's the best way to classify the answer. I will note that if you can see on the side of the slide with a number of the definitions of some of these answers, one of the resources we provide is called a quick reference guide, and it's a really useful tool because what it allows you to do is see as a volunteer or a staff person conducting the point in time some of the exact definitions of what these particular answers mean. So it's really helpful for volunteers or someone who may not be as initiated as some of the folks who have done this count in the past to understand these answers and really be able to give accurate data when they're interviewing someone. One of the examples I like to point out is there's an option here called safe haven. A lot of folks get confused with that one, but if you note the definition here on the slide, it's actually a specific type of HUD designated low barrier program for 25 or fewer homeless persons who kind of come in on a drop-in basis. Maybe they have mental health and substance abuse issues. So it's really not what many people might think if you just hear the words safe haven. It's not a domestic violence shelter, and so it's something that you can really use that quick reference guide to really educate folks and make sure that when a respondent gives an answer to this question, which is kind of the important question of the survey, noting where they stayed on the night of the count, that we get accurate data. Okay, so you can take note of that for question 1. On question 2, in what town did you spend the night? You can put town, county, state, and then, if applicable, the program name and agency name. If you're conducting a paper survey with someone who's on the street or is unsheltered or staying somewhere else, you know that they're not going to be affiliated with a program or an agency where they stayed last night. So if that doesn't apply, you can leave it blank. In fact, for any answer on this survey that you're conducting, if someone gives no response, please leave the answer blank. That's how the folks who are entering the survey into our online SurveyMonkey data collection tool are going to know that it's no response if the answer is left blank. So if someone chooses not to answer this, you would leave it blank. But otherwise, please ask for this information. And again, you're not necessarily going to get a program and agency name. Also, something that happens some years with folks who are doing like a Project Homeless Connect event, just clarify with your volunteers that anyone who walks in the door and is getting surveyed, the place that they're spending the night is not necessarily the place that they're getting surveyed. So make sure that when they're asking about where they spent the night last night, that they're putting the program name and agency name of where the person stayed, not just where they're talking to the person or where the respondent is doing the interview for the survey. Okay, on to question 3. How long have you been in your current living situation? That is pretty standard and pretty easy. Their answer is going to fall into one of these categories here. However, the key thing to remember is that you're asking only about their most recent continuous living situation. Basically, question 3 is asking about how long the respondent has been at the living situation or the housing location where they noted they were in question 1. Right? Because if they're in a most recent continuous living situation, it's going to be the same as where they stayed last night. Even if they stayed for one night in emergency shelter, their most recent continuous living situation was only 1 day to 1 week in that shelter. Even if they've been in, a unsheltered situation prior to that, that is not a continuous living situation. So just make sure that that's the way you keep in mind to ask question number 3. And then also, if someone's saying they've been on and off homeless for 2 years or so forth, you're going to need to drill down on that and just ask them where they've been in this most recent location. For question 4, how many separate times have you been homeless on the streets, in emergency shelter, or in a safe haven within the past 3 years? You're just going to give a number answer. If you're someone that enters information into HMIS, you'll note that this is a change along with the data standards change that HUD mandated for HMIS. And the reason is that HUD has adjusted its definition of chronic homelessness. So the definition of chronic homelessness is a person who has a disabling condition and has either been homeless for 12 months continuously or 4 separate times in the past 3 years, and the total number of months they've been homeless has been 12 months or greater. So it's really important to get a good answer to this question. However, it's a very tricky answer to get sometimes. When people ask me whether or not they're allowed to go off the script in the survey, I say that the tool is there to help you get accurate information, and if you have to clarify something with folks or ask something in a different way to get accurate information, that's fine. The only thing about question 4 that I would caution you, and question 5, is not just to do shorthand how many separate times have you been homeless and then not mention on the streets, in emergency shelter, or in a safe haven. The reason being is that someone who you're talking to's definition of homeless might include something that HUD doesn't include as the definition of homeless, like they were evicted and they had to stay with friends and family for a while. Technically, even though we may feel or they may feel that that is homeless and that's a really at-risk situation, HUD doesn't define that as being homeless, so we have to ask about these specific locations. And also, emergency shelter, another way of counting emergency shelter is if someone was staying in a place, in a hotel or motel, for instance, that was paid for by another agency like a Board of Social Services. So technically that counts as emergency shelter. You can keep that in mind. One thing I find helpful when you're interviewing folks is to ask them maybe their story, to explain kind of where they've been staying over the past 3 years or so, and maybe come up with a time or an event in time that helps them mark that, so that you can kind of get a picture of what's going on and maybe get a better answer by virtue of that conversation. Okay, and the other point here is that you're not just asking about multiple nights of homelessness. So if someone's been in emergency shelter for 4 nights in a row, that's not 4 separate episodes. This is asking whether there have been separate and distinct episodes in the past 3 years in these particular locations. So they would have had to maybe been on the street, and then they couch surfed with a friend for a while, then they had to go to a shelter because they got kicked out, then they went and found a place to stay for a little while. Those would be separate and distinct episodes. It wouldn't just be one continuous episode of homelessness. I know it's tricky. This guidance is all spelled out in some of our other guide tools, but if you have any further questions about this, feel free to write them into the box on the side or to email njcounts@monarchhousing.org. For question 5, what is the total number of months that you've been homeless on the streets, in emergency shelter, or in a safe haven within the past 3 years? Again, it's just going to be a number that you write in. The really critical piece is whether it is above 12 or below 12 months. That's going to be the most important thing, because like I said, that goes to defining whether this person is experiencing chronic homelessness or not. If the respondent, however, has never been in a homeless situation, you could enter NA, or not applicable, because they've never been homeless. I think that we're going to find a lot of folks answering this with a 0 anyway. If the person hasn't been homeless, and that's fine. We will see how this question works this year. But again, this is one of those that we had to change based on the HUD data standards changing as well. Okay, question 6. On to household information. This is the big part of the bottom of our first page of the survey, and we're asking about household information here. As Thaisa alluded to, you can put the information for multiple household members here, but this first part is very simple. It's just asking for the number of adults and the number of children in the household. If it's just a single adult, please put 1 adult and 0 children. Make sure you fill that in, and also include the respondent in the total household size. So for instance, in the slide example, you may be speaking with an adult who's 20 years old, who lives with their parents, and they have a child as well. So that would mean that you're including the respondent and their parents, all adults, as 3 adults, and 1 child as the child. Please, this is very critical to remember, do not include household members that have spent the night in separate sleeping arrangements. Do not include them on the survey with the respondent. So it's very clear it needs to be clear when you distinguish with them that you're not just asking about what their family makeup is, you're asking them about what their household makeup is. So their household is, in the purposes of this survey, just going to be defined as the folks who shared their sleeping arrangements on the night of the 26th of January. So let's say there's an example of a family and they have an adult male child, and your emergency shelter does not allow males over the age of 18 to be in this shelter. So if you have folks staying overnight in your shelter and you conduct the survey with them, it's going to just be the mother and the 2 children. That means that you would not include the adult male member of their household in their survey because they didn't share their sleeping arrangements. Hopefully that individual male's information would be captured by wherever he stayed on the night of the count. Or there's often examples of a mother who's or parents who are staying in shelter, but the children have been sent with family or friends. Those children would technically not be counted as homeless by HUD on the night of the count. So you would need to not include them and just include the folks who shared those homeless sleeping arrangements, so you could count them on the survey. That's really important and also a little bit tricky. On to 6B. This is the big one. Okay, as you can see, there's numbers down the left side, 1 through 7, so that you can distinguish each household member. Please fill this out as completely as possible for every household member, again, that shared the identified sleeping arrangements in question 1. And if household members spent the night separately, don't include them. As Thaisa mentioned, if the respondent's unsure about some information for his or her household members, they can just give their best guess. We want as complete a picture for each individual as possible. And if the respondent gives no response for his or herself regarding age, gender, ethnicity, and race, you can please guess those answers on their behalf. If you're conducting an interview with them, you'll be able to observe approximately what their age, gender, ethnicity, and race are and give your best guess, but do not guess about other household members. If they say that they stayed overnight with family members or other folks, do not guess their age, gender, ethnicity, and race if there's no response given for those household members. So for instance, if you're working and doing a survey with an adult female who said they had their child with them, but they are not willing to give the age, gender, ethnicity, and race of the child, don't guess the information for the child, right? Because they may not have the same ethnicity and racial background as the adult. We don't want to just make up information, just want to get as accurate a picture as we can possibly get. Okay, and if the respondent gives no response for a household member, please at least try to get a gender and age for each. This is really critical for us when we're trying to interpret the results of the survey and communicate them to HUD as required, because if we don't have a gender, then they don't fall into one of the reporting categories, and we really can't report them easily. And for age, we need to know if they're an adult or a child for the purposes of reporting. Also, the way that Monarch deduplicates is we use a combination of the initials that are gathered plus gender and age to create a unique identifier to make sure we don't count people twice. So it's really important for us that we have this information so we don't have to artificially change the numbers. We know whether we've counted this person before or not. Okay? Moving on into detail, these are some of the possible responses for relationship to head of household, and these are in the quick reference guide so that you can refer anyone to these possible answers. If with these initials, again, as Thaisa had mentioned in the outset, some people are going to be resistant to giving personal information to someone who's interviewing them, and you know what? You may not be able to get past that with some folks because of their legal status or because of their mental health issues. If they're too paranoid to give you that information, that's understandable. All we can do is assure you that really this information is totally going to be anonymous, and we are not going to be using this or sharing this information. The only reason that we ask for this information is to make sure we don't count people twice. Like I said, we use these particular pieces of information, these initials, to make sure we are not counting people twice. We create a unique identifier so we can deduplicate. So if that helps you get through to anyone, if you can communicate that emphatically that this is totally anonymous and we just want to make sure we don't count them twice, then hopefully if that gives you one more better interview, then it's been worth it for me to tell you. If there's no middle initial, you can leave that space blank. Otherwise, fill this out as completely as possible for each member of the household. Okay, on to age, gender, ethnicity, and race. Again, for age, you're just putting in a number. And for gender, just so you know, in this section for gender, ethnicity, and race, the point in time count reporting requirements are brought to you by the same federal government that brought you the census. Okay, so the reporting requirements and the options here are not dictated by us. They're dictated by how HUD wants the information. So for gender, the options given are female, male, or transgender, however they identify. And then for ethnicity, they're going to be either Hispanic or non-Hispanic. Okay. If you are speaking with someone and asking them about this information, the uncomfortable situation that you'll be in if they say, okay, what's your race? And they say they're Hispanic or Latino. Unfortunately, the way that the government views that is just your ethnicity. Okay, so what you would do is need to be asking someone, okay, I'm going to mark that down as your ethnicity. Do you identify with a racial background as well? Maybe white or black or American Indian. So those are some of the key things. And then under the race category, please remember, as you can see in this example on the slide, you can put down multiple races. If the person identifies as multiple racial backgrounds, that is an option for you. You can just make sure you familiarize yourself with these abbreviations. We also have put out an abbreviation guide, and I believe it's also in some of the definitions in our other data collection guidance. We just want to make sure that you have space to put the answers in the small margins, and so you can use the identified abbreviations for the racial definitions. Okay. On to the household characteristics. This is still at the bottom of the first page under question 6. And we are going to ask again here that you see it says check all that apply to each person. So you can make sure that you ask about all of these possible characteristics for all of the household members, whether they're a victim of domestic violence, a veteran, or have any of the identified disabling conditions. Really, really important in question 6. If there is no response, as I said before, you can leave these rows blank for a household member, but only if there's no response. If it's the case that a household member is not a victim of domestic violence, a veteran, or has any of the identified disabling conditions, please note the furthest column to the right says none apply. Okay, that's really key, that if one of the household members does not have any of the identified characteristics, that you check none apply rather than leaving it blank. Because as I said, leaving it blank indicates that it's not no response given, and that's not going to be accurate in that case. Again, to the right, you see some of the definitions borne out here. Those are some of the things that you'll find in the quick reference guide, and you can refer to those or refer your volunteers to those. When you're done with question 6, please just check and make sure that you have the right number of adults and children in 6A for the number of folks you put in 6B. It's an easy way to check that your information is accurate, and that's just going to help us make sure that we got everybody's rows filled out. On to the back page of the survey. These go quickly. This is number 7. Where was your last permanent address before becoming homeless? Please put the town, county, state, and country. If no response is given, you can leave it blank. And again, that's the last permanent address before becoming homeless. If the person didn't become homeless and they're just at risk, you could put NA in the town field. On to question 8. What was your residence prior to your current living situation? Check 1 only. Okay, so check 1 only means you're just going to ask the question in bold, and when the respondent gives you an answer, you interpret that answer and choose the one that's most appropriate. There is an other box, and you can check that and write in as necessary. but also remember to clarify that this is the residents prior to their current living situation. So if this is someone who has been in emergency shelter for a week's time and had come from an apartment that they rented, then this answer would be from an apartment or permanent housing. Okay, so that would be really important to distinguish between, it's not just last night or the night before where you stayed if they stayed in the same location. It's the residents prior to where they are now. On to question 9. Which of the following do you or anyone in your household receive? Okay, this is a second check all that apply answer. So since it says check all that apply, I'm going to ask the respondent, which of the following do you or anyone in your household receive? Does anyone have any SSI benefits, SSDI benefits? Anyone have TANF or GA if it's a single individual? And then you can ask about unemployment and all those other sources of income there. But please note there's 2 columns here. And that second column is for non-cash benefits. Don't skip that over. Be cautious there on question 9. And you're going to ask about all of those non-cash benefits like food stamps, Medicaid, Medicare, etc. as well. Again, if there's no response, you can leave it blank. But if it so happens that the person you're talking to has no source of income or is receiving none of the identified benefits, you can check off those boxes down at the bottom. You can see that there's no source of income under sources of income and no benefits under non-cash benefits. And of course, there's still the other option, just in case that's something you need. And these options are also somewhat tricky to distinguish for someone who's not really in the homeless service world. So please refer them to the quick reference guide and other documentation if they need to distinguish between something like SSI and SSDI. For question 10, what is your total monthly household income? The 2 key words are monthly and household. Okay, in past years of the count, we have seen that there have been some very wealthy homeless persons somehow because someone mistook this answer as an annual income. And so that's a big problem to skews some of our data. So please remember it's monthly. And then household. So any member of the persons who slept together and shared that sleeping arrangement right in the identified sleeping arrangement in question 1, anyone who is in that group, that household, has to have their income counted in this measure or in this question. So even a child that had SSDI benefits or adults that had a working income, all of those would be added together for month by month what their income is. For question 11, would you or anyone in your household like to receive any of the following services? Check all that apply. I'm going to read that question and then ask them about all of these options, or check and fill in other if that's the case. For question 12, what was the primary factor that contributed to or caused your current living situation? Check 1 only. Again, you're just going to ask the question, see what they respond with, and then interpret that answer and check off or mark the appropriate response. Then, of course, you're going to thank folks for doing the survey, and that because that takes a lot of time and it's some very personal information that they're helping us gather. And then when you have completed your surveys, make sure that you have talked to your local point-in-time coordinators about what to do. In some communities, there is centralized data input, so that might mean that you're being asked to turn in all your surveys as soon as they're completed. However, as you see in the second bullet, there is a possibility that every single agency or volunteer group that's going to participate is being asked to enter all the surveys that they conducted themselves via our online survey tool in SurveyMonkey. So please make sure you know how this data from the paper survey is going to be inputted online. It's really crucial because if we don't have this data entered online, we don't get the information to include in the count. Just the paper survey itself is not going to do it. We need to gather it into the online tool. So make sure you communicate with your point-in-time coordinators about whether you as an agency or someone else is going to be asked to enter the data online. And we also have a data collection guide for the online tool that's available on our website, so you can refer to that and I'm going to get to that in a moment. Just make sure, again, get that information from your point in time coordinator. Okay. If you are called upon to enter the data online in SurveyMonkey, it's a fairly simple process, especially if you've done it in the past, but here's a little refresher, okay, because this is, oh, well, first let's get to the survey timeline. Okay, this is also critical information for you to jot down. The practice online link is already available. That has been sent out to the local point in time coordinator. So if you didn't get it and you want to see it, please contact them. They have it to be distributed. Basically what it is it's a beta version of the final survey that's available for you to test out. So take a look and go through it and see how functional it is for you. Make sure you know how it's going to go so that you can be fast at it if you have a lot of them to do. Okay, the live link for the non-practice or the final survey is going to be available in January the 20th for certain agencies. Basically, we're going to ask that unless you have a project like a Board of Social Services with projects that are sustaining people month by month, and you know that folks are going to be homeless in your program on the night of the count, do not do any surveys prior to January 27th online, because we really just want to get that information about the night of the 26th and we want it to be accurate. Okay, so the data entry period is going to be from January 27th through February 10th. As you see on the bottom row, no later than 5 p.m. on Wednesday, February 10th. That's when we're going to shut down the data collection tool online and collect all of the survey data. So that's 2 full weeks following the date of the count. Okay, and also for when you're actually doing the date of the count, as you see in that 3rd row down, we're just going to make sure that if you're doing an overnight count, you can start after hours after dark on the 26th of January into the 27th. That's the key overnight time frame we're asking about. And if you're just doing daytime counts or service-based counts or Project Homeless Connect, we ask that you do those on Wednesday the 27th of January. And like Thaisa mentioned, if your community is telling you that they're doing a 7-day service-based count, you could then do it for the 7 subsequent days. But make sure you know what your community is doing by talking to your PIT coordinator. Okay, key things to how to enter data online. Click the live survey link. Okay, our practice survey link will be defunct, so if you get there and it's not working, you'll know that you have the wrong link. That's going to be sent around once the live survey is ready to go, and your PIT coordinator will be dispersing it to you. It's recommended that one person do the data entry because we want to make sure that the data entry is uniform. For instance, making sure that everybody is putting in the same standardized agency and program name. For instance, you know, if someone is entering half the surveys and another person's entering half the surveys, and you both call the program something else accidentally, even if it's just a little bit different, that's going to be something that's difficult for us to sort out on the back end and make sure when we compare it to like the shelter summary form that we're asking you to do, that all the data has been collected accurately. Okay? If a question requires an answer but the respondent didn't respond and you're entering that paper survey into the online tool, you'll see that there's going to be a no response option. So you're going to have to check those off if the survey question is left blank. Okay, and then again, if question 1 or gender or age fields are blank, you can still input that data online, but it's going to be tricky because we will probably not be able to use those records because we won't be able to deduplicate and make sure they're not duplicate records, just so you know. Okay, everything that has one of those red asterisks that you see is a required field. Okay, so that means that if you don't answer that field, you can see at the bottom, in that bottom image, that there's a little red exclamation point that says this question requires an answer. So try to avoid those and make sure you have something in every required field. You can see that the navigation on the survey is very simple. In SurveyMonkey, it's next or previous to navigate, and those buttons will be down at the bottom of the page. This is what it looks like. Okay, this is page 1 of 4 As I mentioned, there's the navigation next down at the bottom. It's very easy to see the progress with that progress bar, so you know you're on page 1 of 4. Okay, so this is code, county, agency, and program. That's page 1, and that's all you have. So just enter the correct information from the top of the survey and make sure you have your code correct if it hasn't been pre-populated by your PID coordinator. And then once you have everything filled in, you click next. You're already a quarter of the way done. Okay, so this is page 2 of 4 on the survey, and it has question 1, which is where did you spend the night of Tuesday, January 26th? As you see, there is a checklist, and you check the response that is appropriate and that has been selected on the paper survey. And then down at the bottom, you'll see this is the way we do the other boxes online. So if you have a survey where the answer is other, make sure you check the bottom that says other, okay, as you can see here. And then you'll also need to write into this text box what that response should be. Okay, so that's how we're going to do that in online SurveyMonkey tool. Okay, once you get to question 2, this is still on page 2. In what town did you spend the night? Just enter all that information as appropriate. Don't be afraid to leave program name and agency name blank if there has been no response or it's not applicable. However, as you see, there has an asterisk next to this question, so it's really important. If there was no response given to this question, you must answer something in the town category at least. So that would mean that you would put NA or none or something like that in the town field. And the reason being is if you don't do that, our logic in the SurveyMonkey tool is going to say this person didn't answer the question, and it's going to bounce you back even though there was no response. Okay, so please take note of that on question 2. Down to question 3, how long have you been in your current living situation? Choose the one that's correct and marked on your paper survey. And as you can see, we've added a no response option down at the end there. That's only if that survey is blank for this question. For question 4, this is a drop-down menu. How many separate times have you been homeless? And if there's no response, there is a no response option. Okay, and the same thing applies to question 5, except that it's a not applicable option in case that person has never been homeless in the past 3 years. Okay, so that's the bottom of page 2, questions 1 through 5, and when you are done and you have an answer in every required field, you can click next, and that'll take you to page 3, which is swallowed up by question number 6. Okay, question 6A, you have to answer both adults and children in the household. Even if there are 0 children, make sure you enter a 0. On to question 6B, and this is where it gets tricky. Okay, so it's actually not that difficult, especially if you've done it before. You know that the way to go is to tab across on this tool. So basically what that would mean is you would click here under relationship to head of household, and if you refer to your paper survey, you will know that the row 1 under relationship to head of household is always for the respondent, so the answer is always going to be self. Okay, so that's always the person that you're talking to. So you could drop down there and hit self, and then since that box is selected, you can just hit the tab button and then type in the first initial, and it'll pop up, and you can tab and hit the middle initial and tab all the way across these drop down menus. That's going to be the surefire quickest way if you want to save some time and don't want to just do this all by your mouse clicking and dragging down in the menu items here. Really, really critical piece. Just so everybody knows, SurveyMonkey changed the amount of space we have to move laterally with in this survey. Okay, so if I move my cursor all the way over here, you can see that there's a sneaky little column over here, and that is ethnicity. Okay, don't lose it, don't forget about it, it's there. If you're tabbing across, you'll get there and you'll see it. The only reason I say so is to draw your attention to it so that you don't miss it, because if you miss it, you're going to bounce back when you try to hit next because it's a required field. Okay, so just don't forget about that. Make sure you get that right for all of the demographics information here for your household members. And then you'll note that there are some numbers down the side here. We're just trying to help you out. It's a little bit tricky, but we want to make sure, since you see that there's numbers down here, these numbers will correspond to the row numbers that we put on the paper survey. Hopefully it's going to be something that is pretty easy to follow. And as you'll note, this is relationship to head of household through ethnicity over here. And that means that the one demographic information piece that's left off is next, and it's in a separate question, and it's race. Okay. The reason that it's separate, and I'll just jump ahead to that quick, is that it's a check all that apply, right? Because we said you could put multiple racial identities. So you'll have to make sure that you're, again, making sure that the races identified correspond to the correct household member, and you'll see there's a no response option if that survey is left blank again. All right. So this is what that drop-down menu looks like. If you have some answers selected. Okay, so again, if there's no middle initial, you can select none. You can see all the different options that are available in relationship to head of household. Of course, row 1 will always be self, and then you have the other options over here. Make sure that you enter at least one response, even if it's no response, in every single drop-down menu in row 1. Otherwise, you will not be able to progress to the next page of the survey. That's what's going to be the required field. Okay, so after you've done that, and you've done the race, checking all the boxes that correspond to the right individuals, you will come to the household characteristics question. Okay, again, you'll note that these are numbered rows. Make sure that you're checking off all the boxes that apply to the various household members, and make sure that you're doing it for the right row number that corresponds to that household member. As you'll see, it has grown another column, okay, as compared to the paper survey. That's in case that was left blank on the paper survey. You can enter it as no response. Otherwise, hopefully someone will have answered and all of the necessary characteristics, or if none had applied, they would check none apply. Okay, that's the end of page 3. So that's 75% of the way there. When you're done with this one and everything has a required answer filled in, then you can go to next. Okay, that's page 4 of 4. And it starts out with where was your last permanent address before becoming homeless. As you see, we've lost our asterisks because these are no longer HUD required fields, but please do fill them out completely as possible. If the respondent is not homeless for this question, of course, you're going to be able to write NA into this one. Okay. What was your residence prior to your current living situation? Choose and check the one option that is filled out on the paper survey, or check other and write in write in the response that's appropriate. Which of the following do you or anyone in your household receive? Check all that apply. Okay. And then what is your total monthly household income? For the purposes of the online data entry, please do not enter commas or periods, just enter the number. So if the answer is 1,000, please just answer 1000, not 1,000. That's going to help us out in the formatting. Okay. Would you or anyone in your household like to receive any of the following services? Check all that apply. And then you're on to the end. What was the primary factor? Check off whatever is responded on the paper survey. And now you can see that at the bottom of page 4 of 4, that you will see, instead of previous and next, you'll see previous and done. Just so you know, until you click this button done, none of your information has been submitted. Okay? So if you click done and you see this message saying thank you for participating in NJCounts 2016, you know that your data has been successfully submitted. If you click done and you do not see this screen, okay, this is from the practice survey, it says thank you, it's got the logo, it's all very pretty. If you don't see that, then your data has not been successfully submitted and you might have a technical difficulty. You could call us, or you could make sure that you enter it again if something happens in your browser or something like that. Okay, so once you get to this thank you screen, if you are done entering surveys, you can just hop out of the browser, close the window, and you know, go to Google or whatever you wanted to do next. But if you do have more surveys to enter, if you click this Done button on the thank you screen, it's going to take you back to the beginning so you can enter another survey. It's going to take you to the blank SurveyMonkey form for another entry. Okay, so that's the online data entry. That's the real key to us getting the information associated with and affiliated with the paper surveys. So I'm going to pass it back over to Thaisa for all you folks who are doing HMIS data entry for the point in time count that we'll be pulling. She's got a couple of important guidelines to remember about that.
Thanks, Jay. Just one other quick note I wanted to make note of before we go on to the HIMIS piece. For anybody who is completing a survey in SurveyMonkey, that when you're entering the survey, if you find that you've completed a survey, submitted it in the system, and then realize that you've made a mistake, please just send us an email, contact us, let us know, because if there's a major error, if you double enter a survey or something like that, if you let us know when it happens, then we can make note of it and then track it down when we are doing the deduplication process. So if you know that you've made a mistake in the system while you're entering the surveys, please make note of it and then let us know so that we can track it down later. So now I'll just give you a few pointers regarding the HIMIS data pull that we will be doing for the sheltered count for any agency that is entering information into the HMIS system. Again, as I mentioned before, it's going to be critical that we get the sheltered summary forms so that we can double check that the information in the HIMIS records as well as information from the SurveyMonkey records entered into the system are accurate, that we have the accurate number of surveys in the system or accurate number of records. So we are asking again for those to be submitted by January 29th by 5 p.m. So once again, here's a couple of dates regarding the HIMIS count piece of it. So the count will be done. We're going to maintain the same thing so it will be January 27th. We're going to be looking at the people who are in your program the night of January 26th and on the 27th. In order to verify the information in your system, we're going to give you some time to update your HIMIS records to make sure that you have all the information for people that are in your program. So we will do an initial pull from HIMIS on February 3rd. We're going to do an initial pull just to look at the total number of people that are in your program on February 3rd, and we will compare that to the sheltered summary form that you guys submit to us. Just to ensure that we have the accurate number of records in the system. If there are any discrepancies, we will reach out directly to the PIC coordinators and work with them to contact the agencies to ensure that the HIMIS records are up to date and that you have all the information for all the people in your program in HIMIS for the count. So there will be about a week between when we do the initial pull on February 3rd, where agencies will have an opportunity to clean up any data, to address any discrepancies, and we will be doing a final pull of HIMIS data on February 10th. That is when we're going to be pulling the information from the system, and whatever information we pull from the system on that date, you need to finalize the information by 5 p.m. on February 10th. Whatever information we pull from the system will be the final information we use. So if information has not been updated, if records have not been corrected, we're going to just go with what we have in the system on that date. So it's going to be critical you have, for any agency that has a HIMIS program, you have about 2 weeks to ensure that the data in the program for the people that were in your program on the night of January 26th is accurate. So again, a couple pointers: make sure that the information is accurate for people who are in your program on the night of the 26th and the 27th. You need to make sure that you have both the individual data and the household data, that it is accurate, that you have, if you have a family that you're serving, that you have the information for the adults and the children in the program. If you have only individuals, that you have information for all of the individuals in your program. There's a couple of opportunities where you can update information. Please make sure you're updating the client information. If the person has been in your program for a while, for example, for transitional housing programs, they've been in there for quite a period of time, You still want to double check and make sure that the records are accurate and update any missing information or client income, make any adjustments so that we have the most accurate, most up-to-date information for each of the people that are in your program. Please note that we really cannot use anything that says don't know or no response in HMIS. So if a person has come into your program and you initially enter them with don't know or no response, please note that that's not going to provide us any valuable information, and we won't be able to use them for understanding the needs of the population. So we are asking you to avoid at all costs don't know or no response. Make sure that you get information from the clients. We understand if people refuse to answer things, and that's, just it is what it is, but please try to answer all of the questions in the system so that we can have an accurate understanding of who's in the programs. So here's a list of all the fields from HIMIS that we will be using for the point-in-time count. I'm not going to read through all of these. These slides and this presentation will be available for you to reference at a later date, so you can take a look at it if you are a HIMIS program. But we will be pulling information from all of these areas in order to complete the data analysis for the point-in-time count and the final numbers that we pull for reporting to HUD, as well as for the final report, point-in-time survey report that we put together. So please be sure that these fields that are listed here are accurately completed within the system. So as Jay has mentioned, and I think we've kind of gone over this quite a couple of times, HUD has updated their definition of chronically homeless, and in addition, HMIS has been updated based on updated data standards that have been issued by HUD. As a result, there are 2 new fields in the system that you have seen for the last couple of months. I just want to highlight and reiterate that it is critical that we answer all of this information. So all of the information that you see on this slide in terms of the amount of time that people have been homeless, the long length of time that they're in the program, and their specific disabilities will be critical for us in order to classify them as chronically homeless. I'm going to spend a little bit of time on this because it is kind of critical that you answer this information correctly so that it is accurately reflected within the survey and within our report. As similar to the survey, we changed question 4 and 5 on the survey to ask the number of times that you've been in emergency shelter, safe haven, or on the streets in the last 3 years. We phrase that question to match what is in HIMIS. Please be sure that this information is answered in your HIMIS record for each client, as well as the number of months that they have been homeless on the streets, in emergency shelter, or safe haven. We will need this information to identify those households that have had the length of time necessary to qualify them as chronically homeless. We will be using the length of program stay as well to identify whether households are chronically homeless. In terms of disabling condition, I want to spend a little bit of time on this. The disabling condition question has, in HIMIS, they automatically calculate the chronically homeless status of households based on how you're answering the disabling condition questions. Within your intake, you have the ability to identify which specific disabilities people have, so you can identify whether they have a physical disability, developmental, chronic health, HIV/AIDS, mental health, or substance abuse issue. Once you've identified that they have one of these conditions, the next question that the system asks is whether or not this condition is expected to be of long, continued, and indefinite duration and substantially impedes their ability to live independently. It is critical that if this person needs supportive housing, would benefit from supportive housing, that you check this box to indicate that this is a condition of long-standing, indefinite duration, and that they would benefit from supportive housing, that it impedes their ability to live independently. I know that there have been some questions about this and what's the definition of living independently. Essentially, for the purposes of HIMIS, for the purposes of this question, and also for the purposes of our report, what HUD is trying to get to is to understand who needs permanent supportive housing. So for example, you can have a person who has a mental health issue, but they do not need supportive housing. And so if you do not check the box, they're going to be labeled as not having a disabling condition, and they would not qualify as chronically homeless. On the other hand, you can have a person who who has a mental health issue, is able to live independently but needs case management services, needs somebody checking in on them every once in a while to kind of make sure that they're doing everything, that they're taking their medication, that they're, participating in the programs. For a person like that, you would check the box saying that they are expected to have a condition of long and continued indefinite duration, and that it impedes their ability to live independently. By checking this box, you are indicating that they do have a disabling condition, thus qualifying them potentially as chronically homeless. So I just want to reiterate, please be sure that you are thinking about, when you're answering these questions about disability, and figuring out whether or not to check the box about the length of their condition, the length of time the condition will be around, and whether or not they can live independently. Think about it in terms of whether or not this person needs permanent supportive housing. If the answer is yes, they need permanent supportive housing, then please do check that box. And that way we can then look and see if they would qualify as chronically homeless. If you do not check that box, they automatically are not considered chronically homeless and would not qualify under the new HUD definitions. In terms of the information about the household, we will be pulling information so that we can set up the unique identifiers for the client, so we can do the deduplication process, and we look at name, relationship to primary client, date of birth, race, gender, and ethnicity to do that deduplication process. Please be sure that this information is completed, filled in accurately. Please, we have seen quite a few times where the date of birth is confused with the admission date, and so we have people who are in programs who are in adult shelters who are less than 1 year old. So please just be sure that you are entering this information in accurately and entering it in for each person in the program. One way to check this is that you can run an AHAR report for your program and identify if there are any records with missing information or inaccurate information if you have children in a program that should not have any children. This can be done from the HIMSS home menu. You can, once you're logged into HIMSS, you click under Administration and then click under Fiscal Reports, and there should be a button for the AHAR report right there. You can run an AHAR report for your program for the day of the count and see if the information in that report has anything funny. So what you would be looking for is missing information for any of the clients in the program on that day, as well as if you're in a program that only serves adults, you'd be looking to see if there are any children listed in your program. That it's a good way to kind of double check your data quality. So we do strongly encourage any HMIS programs to run the AHAR reports just to make sure that the information is accurate for the people who are in your program. We are in the point-in-time report that we put together that we distribute for each of the communities. We do include information about monthly income, cash benefits, non-cash benefits, and health insurance. Sometimes this information is available when the person enters your program, especially for transitional housing programs. It may have changed since they entered your program. Please be sure to update this information. You do not need to change the admission record for the household, but what you can do is do an update of the record and enter this information accurately. So if there's any information that you learn after the person has been admitted that is different from what was first given to you when they were first admitted to the program, please be sure to update this. And this also applies to things such as disability, as well as any of the gender, race, ethnicity, any of that information. They may not have given it to you when they were first admitted into the program, but at this point, if they've been in your program for a while and you know the information to be different, or you know that it has changed, please update those records so that we can have an accurate count and we can have an accurate understanding of who's in the program and what their characteristics are. When we were looking at disability and the different subpopulation characteristics, we'll be looking at these specific fields. So just make note of that and make sure that the information for these fields is accurate for each person in the program. And as a note, I think I said this earlier, if you are a program that is specifically set up to serve a specific type of population, please be sure that every person within your program has that box checked for that characteristics. So for example, if you are a veterans program and you only serve veterans, please be sure that each person in that program has been identified as being a veteran. When we are pulling the information from HIMIS, do not know all of the programs and what they're specific, what they've been specifically set up to who they've been specifically set up to serve. So we have no way of adjusting that. So please be sure that if your program is serving specifically persons with HIV/AIDS or persons with mental health issues or persons who are veterans, that you identify that each person in the program has that condition. If you do not identify it, then they will not be counted as falling into that category, and we'll have an inaccurate count of the number of people with that issue or condition or within that characteristic, and we'll have an inaccurate understanding of the level of need within the community. We are also looking at using this information for determining the residents prior to program entry. We know that the zip code of last permanent address is no longer a required field in HIMIS, but we're asking that you please enter this information for the point in time count. This is something that we do include in our report to identify the number of people who are homeless in the community, who are actually from the county, outside of the county, outside of the state. This is very important information that lots of communities use. So we please ask that you enter the zip code of last permanent address, regardless of the fact of whether or not it's a HIMIS required field. You also want to be sure that you're entering the residents prior to program entry, homeless cause, and services sought. Those are all things that we include in our point-in-time report that are used for the local planning purposes and are critical information for us to understand what needs to change and how we're addressing homelessness in the community. So please be sure that that information is updated and accurately reflected for all the people who are in the program. If you're unsure about how to update or correct any records in HIMIS, I will tell you to please contact HMFA. Every community, every county has a representative at the HMFA office, the HIMIS office, who can help you through that process. They will be able to give you pointers, guidance on how to update records, how to correct any information, and to troubleshoot if there's anything specifically wrong in the system. We are familiar with HIMIS, but we cannot walk you through the process of actually correcting records. So I would strongly encourage you to connect with your HIMIS, HMFA HIMIS representative if you have any questions about how to update or address any issues within the system regarding the records that are in there. And with that, we're winding down to the end of our webinar. This is our first webinar where we are going through the point in time survey and the training. We will also be holding another webinar, a similar one, on January 25th at 10 a.m. for anybody that has not been able to participate in the local trainings in their community. And again, as I mentioned, each community will have some in-person trainings for anybody administering the point in time survey. Please contact your point-in-time coordinator for more information about the date and time of your local trainings. If you need to attend it, or if you need to send anybody, if anybody you know needs to attend those, please contact your local point-in-time coordinator. Thank you for being so patient and staying on the line and participating in this webinar. As we mentioned earlier, all of the information about the point-in-time count can be found on Monarch Housing's website under NJCounts. When you log on to Monarch Housing, or when you go to Monarch Housing's website, you will see a tab at the very top that says NJCounts, and all the information for this year will be available there. If you have any questions, you can email njcounts@monarchhousing.org, or you can call the number there on the bottom of the screen, 908-272-5363, extension 222. We look forward to working with you during the point in time count this year, and hopefully this year will be just as successful as it has been in the past. Thank you again for participating, and have a nice day.